As you can imagine, AI is not just a big, scary thing in the future. So this is a Pew survey from the 2025. Can see that AI is not just far future. So 95% of the US adults has already heard at least a little bit about artificial intelligence. And the share saying that they have heard a lot has increased from 26% to in 2022 to the 47% to as of 25. So actually, and about like almost two-thirds of the US adults says they actually used at least once a week for using some kind of AI. Actually, AI may also be kind of in the background, even though you're not aware of that, such as like the spam filters and the navigation systems when you are using the Google Maps every day, or even just voice systems like, hey, Siri. So those are all very AI powered in a certain sense. There are also certain concerns about most Americans, how their views their AI is playing their role in their personal lives. So there are certain concerns about AI interfering too much about within their personal lives and potentially have some privacy concerns. Also, there are some concerns of AI in education, how the AI will maybe diminish the creativity of human beings, etc. So this will be potentially discussed later, the kind of risk and bias of AI. So we will have a more deep dive later, another lecturals. For AI healthcare system, also a survey from McKinsey find out that 85% of the healthcare leaders, including payers, healthcare system, and technology providers, is experimenting or have already deployed some kind of AI systems in their institutions. The AI not just used for diagnosis, but also very heavily used for administrative efficiencies, like such as scalings, billings, patient messaging, or AI script. Also, there are some AI systems were involved in like clinical trials, so they can match the patients, qualify the patient for certain clinical trials. Those are very kind of helpful for clinical research and clinical activities involvement. The federal is also supporting AI involvement in medical health. There are, ever since 2018, the Luminetic Core, which is the first kind of full automated AI diagnosis systems approved by FDA, which is used for detecting diabetic retinopathy pathology. And then to now, as of 2025 July, the FDA has listed over 1,200 AI-enabled medical devices, which is a huge jump from 2024. So most of those actually involved in radiology, like 77% of them, and others there are 9% in cardiovascular field, and there are some field in neurology. You may wonder why radiology. So usually AI, especially this kind of AI, very used mostly for like imaging detecting. This imaging detect the imaging AI is very good at excel at like the pattern recognitions. So they're very good at imaging detecting, especially some kind of pathology kind of detection from like the medical imaging, like CT scans and MRIs and other kind of medical imaging. So those are very helpful, actually very accurate, I will say, in the data I show later. So another part of, I think, this is just an example of one of the systems used. So the first on the left-hand side, it is AI pathology diagnosis systems for detecting breast cancer. And this actually among kind of 32,000 images from more than 8,000 patients. The average reading time per slice decreased almost 50%. Right, and then the sensitivity is increased about like 20%. So this is a huge kind of gain for the physicians and also for for the patients as well. And also sometimes I think it is interesting to the use case of AI is sometimes when patient or not really here for one particular diseases, and those, for example, when people are going to ER, they may have their bone broken, or they will do some CT scans. However, they also may have early lung cancer. This will not be usually, or this will be ignored for the physicians who the ER physicians, because this is not the primary reason for admission. However, AI would be able to used for this kind of early lung cancer detect, even though this was not primary reason. So this will be very useful to have a generally kind of proactive kind of scan or proactive use for patient care. Another use of AI is ambient AI scripts. This is actually very quite wild adopted in a lot of healthcare systems. Randomized controls trial, I show in the right-hand side, see that the average documentation time was reduced when physicians are adopting this AI assistant, APM. AI script. So this will also increase the efficiencies of the patient care. So these are some kind of AI implementations right now. So, but there are also some new kind of advancement or thought stream. For example, the next frontier is agentic AI. So agentic AI is a little bit different. You consider as the third wave of AI. So unlike the standard model that waits for a prompt, which is a little bit reactive, agentic system is more like a proactive. So it could have an agent to plan multiple steps of workflow and use the external tools to kind of complete and processing the desired task. What is more promising or more kind of interesting, it is when multiple agents are working together, it could be some kind of autonomy. So in China, actually, the Tsinghua University actually launched kind of fully AI-powered virtual hospital. I actually didn't find how useful it is right now in the data, but I think it could be very useful in the near future. But the key point is, as I can see showed prior, even all these AI-enabled devices, they should have checked by human physicians. So usually they will be human looped for these systems. Another kind of innovative frontier for AI is drug discovery. Actually, there is the company called In Silico Medicine is also already used the generative AI to identify biologic target and design a new drug molecules in under 30 months. Though usually compared with the traditional way of drug discovery, which takes about 6 years. And this medication is currently in phase 2 clinical trials. So the AI will actually involved in these images show the kind of how AI was involved in each kind of steps of drug discovery. It also means the humans are also involved in the decision making. That's basically and with my introduction of AI in history and current and future. I hope this will excite you to learn more about the AI and have envision how you could potentially adapt the AI systems in your workforce. And then the later part, I will try to introduce a little bit more for jargon about AIs, especially some fundamental definitions and types of AIs. And you can pause if you find these diagrams a little bit intimidating, but don't feel too discouraged about that. I think the most important thing is it is the time to start to use it and learn more about it.